Okay, next one, we're going to go after the subclavius. And some people actually don't even have this muscle. So the typical referral is just right around this region. And then it can actually go down the arm a little bit. So it's basically, the origin is the first rib and cartilage region. And insertion is inferior and lateral aspect of the clavicle. So right and around it here. And the major actions are it elevates the first rib and stabilizes the joint and draws the clavicle down. So it brings the clavicle kind of down then, okay? So with this one, what you have to actually do is find the clavicle region. And you got to kind of hook underneath of it and then kind of palpate around. So again, if you feel any round lumps, anything in these regions, make sure you don't push right on there. But what you're trying to do is trying to find a referral, so it's going to go around here and then also down in this region here. Okay, next one we're going to go after is the brachialis. And with the brachialis, what we're going to do here is I'm going to bring out the arm right here, and we're actually going to pinch right in this region here. Okay, for the referral for the brachialis, it actually goes down to the middle finger. So it'll actually go down all the way to the middle finger for the typical referral, and more on the posterior side of the arm all the way down. Okay, the origin is the coracoid process of the scapula, and the insertion is actually the middle of the medial humerus. So again, it's just this little area right here where you can kind of pinch and you kind of roll over that region. And you can actually have them try to bring it towards, kind of forward like this, so you can actually feel that region. Okay? So again, you got to just pinch the brachialis then. So the brachialis, again, it's just right in here, but if you elevate the arm, bring it out, you can actually feel that area a little bit easier then. Okay, for the sternalis, what we're going to actually do is we're going to find the xiphoid process right here, and the sternal notch, and it's basically halfway, and then just a half inch off, right in that region. So this is the area where you're going to actually palpate for the trigger point, and it should actually just refer right around here. And if the client doesn't feel comfortable with you pushing down in this region, you can actually double or triple up a towel, place it over there, so you can actually push down in that region. Or you can actually just use their fingers just to actually palpate, so you can actually push down in that region then. So again, some people don't have the sternalis, and some people don't have the subclavius, but almost everybody again has the brachialis right in this region.